HESC 114, Intro to Pharmacology, Chapter 4, Gastrointestinal Drugs. This is the chapter where we're going to begin to actually learn about drugs. Now, in general, we're not going to focus on learning the top 200, but really our focus is on the classifications. What groups do they fall into? What are they used for? How do we remember some generic names that fit into those drug classes? So first are the learning objectives, which are at the start of your chapter. Before we actually get into the chapter, I wanted to talk about how to look at this information and kind of break it down as you're learning about drugs. Most of you have never taken a pharmacology class before, so this is kind of new to you. The way we group things together are called classes, and there's a couple of different ways that we can do groupings. The main way is the way the textbook is set up, and that's by body system. That is considered to be a therapeutic class. So this chapter is GI drugs, and if you're reading through the chapter, then you have multiple headings that are going to break it into what is the drug treating. So therapeutic is a term meaning treatment. So we're grouping it, but it's not really telling us anything about how the drug actually works. What is the drug doing to treat that condition within that body system? At that level, that's called a pharmaceutical class. We break drugs apart and put them in groups that have things in common, and that may be how they do it. So just as an example, when we talk about antihistamines, they're going to block histamine. They have something in common. That's their mechanism of action. They are blocking histamine. Now, how they might do it could be a little bit different, but we're not going to get quite that deep into some of these drugs. The other is by chemical structure. So like the group of benzodiazepines, drugs like Valium, which is diazepam, or Xanax, which is alprazolam, they have a similar chemical structure. Most often, they're also going to treat similar conditions. So we're going to go with the body system first. So each chapter is a body system. Then within, we're going to look at the headings. What are we treating? What's the condition that we're looking at? And then what groups of drugs treat those conditions? And we'll talk about how they actually do that. So we're going to take it from the therapeutic class down into the pharmaceutical classes. So like I was just saying, we're in the GI system. So even though we're not learning the top 200 drugs, I'm going to introduce you to an example. We call that the prototype drug. And I'm going to give you at least one from each class so that you can use that as the example drug. When appropriate, I will also be identifying drug stems. So previously I talked about the drug stem being the part of a generic name that we can use to help associate it with its grouping. So I'm a visual learner. I like flowcharts. This one is kind of giving us our different levels. So the previous slide I talked about the body system, the therapeutic class. So here we have the GI system. And of course, this isn't comprehensive to the whole chapter because there's not enough room on the slide to fill that all in. But two of the more common things that happen in the GI system, ulcers and GERD, this is heartburn, and nausea and vomiting. So I wanted to pick a couple that you might already be familiar with. What kind of drugs can we use? Now here in this green level, the top level, therapeutic class, body system, the green level is still therapeutic class, the illnesses or conditions that we're treating. And when we go down here to the blue level, we're going into the pharmaceutical classes. So we have drugs like PPIs. These are proton pump inhibitors. You're going to learn a lot more about that in just a minute. H2 blockers. This is a histamine 2 receptor blocker. Antacids, they work against acid, something that happens with ulcers. And then on the other side, we have antihistamines and anticholinergics, which can be used to treat nausea and vomiting, dopamine antagonists, or 5-HT, and that's actually 5-HT3 antagonists. Now, as I was saying, to help identify some of these pharmaceutical classifications, we have drug stems. So proton pump inhibitors will end in aprazole or oprazole, H2 blockers end in TIDINE, and I'll talk about that in a minute. That'll help you remember it's for the GI system. And then 5-HT3 antagonists end in cetron. So you don't need to know every single drug in the group, but if you know that drug stem, you know something about the drug because you know what family it fits into. Okay, so your guided notes, follow along. We're going to go through the drugs again as the book goes through. I'm broken it out into these main titles. So the first part we're going to talk about is the upper GI system. So in the upper GI system, we have the oral cavity, that's your mouth, where your tongue and your throat goes down into the pharynx. And then we go down into the esophagus, which is the tube from your throat, the pharynx, down into the stomach. And that's all considered to be the upper GI. Now, some terminology as we're going through. Some of you have taken medical terminology before. Some of you maybe have even taken anatomy and physiology. Many of you have not. So to make sure that you understand these terms, in the chapter, it does describe what these terms mean. Mucosa is a term, it means the mucous membranes. So that's part of the epithelial surface. When we're talking about an ulcer, this gets eroded away. The term peristalsis is a term for movement in the digestive system. It's a wave-like motion that the muscles move things through. So we have peristalsis in our esophagus, so things can move from our throat down to our stomach. We have it in our intestines that move food and other products, drug products, through our intestines and then out through our large intestines. At the top of your stomach, there is what's known as the lower esophageal sphincter, or the LES. And I'm going to go back to this previous image right here. And it's located actually right here where I'm illustrating with my pointer. It's a valve. Basically, it's an O-ring that opens and closes, so it lets the food travel from the esophagus into the stomach, and then it closes so that the acid in the stomach can't go back up through your esophagus. Now, if something's wrong with that and you get stomach acid up here in the esophagus, we get heartburn, or what's known as GERD, gastroesophageal reflux. And we feel burning because the mucosa in your esophagus is sensitive to the acid, where your stomach actually has a protective lining in it so that it doesn't get broken down by your stomach acid. And then what are the parietal cells? So the parietal cells are located in your stomach, and these are cells that have a role in the production and the output of the hydrochloric acid in your stomach. So we do have certain enzymes and chemicals that our body will produce that will help protect the stomach from the gastric mucosa. And that includes your gastric mucosa. It produces mucus and helps protect that stomach lining from that hydrochloric acid. So that, like I said, it doesn't burn itself. Now, the first disorder is GERD, gastroesophageal reflux disease. So again, commonly we refer to this as heartburn because that's kind of where the feeling is when the acid hits the esophagus. It's right near where your heart is located. So it's called heartburn. Reflux is a black flow of the stomach acid through that lower esophageal sphincter into the esophagus, and it causes irritation, pain, and inflammation. Lifestyle changes can be used to help reduce GERD, and it would be things like don't overeat. When you're too full and there's too much in there, it could push against. Avoid foods that have high acidity, like spicy foods or vinegar or fermented foods. When you lay down, make sure that your head is elevated so it kind of keeps the gravity of things. Things won't flow backwards while you're sleeping. So there's a number of different diet, lifestyle changes that can occur. If they're not enough, then we're going to have to treat with medications. So the main groups of drugs are noted on this slide. And as you're going through, these are kind of in red titles in your textbook. Antacids, H2 blockers, proton pump inhibitors, and drugs that are known as gastric stimulants. These are known as prokinetic agents. And we think pro means good or movement or forward, and kinetics means movement. So this is forward movement. If you need to move things out of your stomach, you want to speed up your gastric emptying so that you have less irritation and less acid, this might be a type of drug that we would actually use. So I'm going to break them down separately. So the first one are antacids. So antacids they work against acid. They neutralize acid. So acid has a low pH. Its hydrochloric acid in our stomach is usually a 1 to a 2 on the pH scale. So it's very, very caustic. And then we use an antacid, which is usually a base, usually a fairly weak base. But again, we're trying to neutralize the acid. So it's going to balance that out. Now, all antacids are oral because they need to work in your stomach. They need to be where the acid is. Active ingredients in these drugs could be a single agent or it could be a combination of any of these agents. Most of these are going to be minerals. So aluminum hydroxide, calcium carbonate, magnesium hydroxide, sodium bicarbonate. Those are the more common active ingredients that are found in antacids. Ooh, say that 10 times fast. Now, you probably have baking soda in your kitchen if you make cookies or cakes. That's actually sodium bicarbonate. We don't advise people to mix this in water and drink it, but if you have a grandma or an auntie, they might do that. Now, in your note slides, I do talk about an acid-base reaction and what's really going on with the acid. So please refer back to those guided notes. Now, a couple of things. Antacids that contain calcium. Oops, I didn't mean to go forward yet. I wanted to do a highlight here. If it contains calcium, let's make sure I have my highlighter and not my pen. There we go. If they contain calcium chloride, a side effect can be constipation. Also, we need to be careful that people stay well hydrated because too much calcium absorbed into the bloodstream could actually affect the kidneys and we could get kidney stones. And calcium carbonate is not only an antacid, but sometimes women use it to help prevent osteoporosis. Now, if an antacid has aluminum hydroxide, aluminum's a metal, right? We use it to strap things. It binds things up. So constipation is a side effect of aluminum hydroxide. And then kind of on the other end of the spectrum, we have magnesium hydroxide, which actually is also a laxative. So if people use too much of that, they might end up having diarrhea. Now, a lot of times we'll mix those two things together. And if we mix magnesium hydroxide with aluminum hydroxide, that's the drug by the brand name of Maalox. So again, your notes illustrates that. Some antacids will have combinations. There we go. And sometimes they will have something to help with gas because they might have acid and gas. Maybe they're feeling a little bloated. It's going to have what's known as an antiflatulent. We're going to talk more about that later in the chapter. That drug is called simethicone, and that helps to decrease the gas. Now, the first drugs are H2 blockers. I use a resource called Picmonic to help my in-program students because pictures and weird things help remember. So I do like to use lots of images. This is an H2 blocker. histamine. The H stands for histamine. It's not the one like you have an allergy and your skin's itching. This is internal. So H2 blockers are used to treat GERD and peptic ulcers, and they were first approved in the 1970s. They block the histamine 2 receptor in the parietal cells in the stomach, which results in a decrease in stomach acid. Now, H2 blockers have a drug stem, and their drug stem is tidine, and I kind of stress that I part with the tidine. So that I is for the GI system. We'll talk about other antihistamines in the next chapter, in chapter 6, when we do respiratory drugs. They end in a similar, but it's spelled different. It's TA for allergies. So those are the little mnemonics that help you remember. Okay, now back to talking about the H2 blockers. So that drug stem, H2 blockers. Now, most of these are available over the counter. Some may still have a prescription or be prescription strength. So that's a whole nother thing. But again, most of these are going to be over the counter. Now, the over the counters often will have something added to their name to help identify them different from a prescription. So here, cimetidine or cimetidine, either one is correct pronunciation. This drug is known as Tagamet. This was the very first one. And the over the counter is Tagamet HB, and the HB stands for heartburn. Helps you remember what we're using it for. Then we have famotidine, which is Pepcid or Pepcid AC, acid control. Zantac 360, that's mostly for name recognition. There was a different drug called ranitidine, which is no longer on the market, that used the brand name Zantac. So when they took that off the market, the people who used to sell it reformulated and now use famotidine, but they couldn't call it Zantac 75 or 150. They called it 360, which is like the whole picture, right? You got the whole circle. And then nizatidine is Axid AR for acid relief. So by adding those little parts at the end, it kind of helps you identify, well, what's this drug being used for? The next group of drugs used to treat GERD are the PPIs, or what are known as the proton pump inhibitors. So PPIs decrease the production of hydrochloric acid in the stomach and raise the pH of the stomach contents. And they do this by blocking the final step in acid production in those parietal cells in the stomach. There is an enzyme called a proton pump. We're not going to really worry about that. What's it doing? It's blocking acid production. So basically what we need to know is that we're blocking the final step in acid production. Now, proton pump inhibitors also have a drug stem. And I know your book says the prazole part of it, or even the azole part. There's too many other drugs that use prazole or even azole. So we're taking it out an extra letter because they have a different letter in that place. So eprazole or aprazole, and examples like lansoprazole. We've got the oprazole. That is Prevacid. It's preventing acid. So again, brand names are helping us with recognition. What is the drug being used for? And as omeprazole, with the eprazole, that's Nexium. So the thing about Nexium, there's an omeprazole as well as this esomeprazole, right? If you think back, we were talking about those isomers. This is an S isomer. Omeprazole is Prilosec, and then they made this revision to omeprazole and made the S isomer, the esomeprazole. This was the next version, Nexium. So they got a little creative with that. Now, sometimes in advertising, they'll call this the purple pill. That's not a name we use in healthcare, okay? It's not the purple pill, it is Nexium. Now, one of the benefits of using these drugs in treating GERD is they also help repair the esophagus when there's inflammation from esophagitis. Okay, so gastric stimulant drugs. Now, we use gastric stimulant drugs to treat GERD as well as ulcers by decreasing the time that the food and with the food, the acid in the stomach are in contact in the stomach. So they speed up gastric emptying. So they increase the response to acetylcholine, a neurotransmitter, which will increase muscle contractions in the GI system and move things out. It speeds up that gastric emptying. This is why they are also known as prokinetic agents. That means causing movement. And there's one drug, and then this drug is known as metoclopramide, which goes by the brand name of Reglan. Now, it increases the response to acetylcholine, but how it does that is by blocking dopamine, which when we get into the muscle system, we'll understand in more detail. But we will talk about this again later in this chapter as a dopamine agonist when we talk about drugs used for nausea and vomiting. Now, we do have combination drugs. So your book talks about Zagrid, which is a combination of a proton pump inhibitor, omeprazole, with an antacid, sodium bicarbonate. And your book talks about how they use the initials from GERD in the brand name to help make it identifiable. So it does have GERD in there. There are others that have combinations like Pepcid Complete that has famotidine, an H2 blocker with calcium carbonate and magnesium hydroxide. So the issue with using these combination drugs, and not issue, but one of the reasons we do that is you're kind of treating it in two different directions. So you're getting more benefit from it. Now, the next thing I want to talk about is your drug worksheet. So a lot of times the students are like, what do I do with this? I did put it on the slide, but I'm actually going to bring up the drug worksheet in a Word document here. Let me enlarge this. So to print this out or to save it and write on it within whatever technology you're using, the way this lays out, this first one is kind of an example. So the blue would be your handwriting, like complete this worksheet. So I've given you the brand name, Digel, Gaviscon. What are the generic drugs? Now this is a combination, so it's aluminum hydroxide with magnesium hydroxide. Then what group does it fall into? This is an antacid. It doesn't have a drug stem. What do we use it for? We primarily use it for GERD or heartburn. And what's the main side effect? It's going to be constipation. So I'm going to come back down here to Tagamet. We just talked about that one, right? So let's just look at Tagamet. So I told you that the generic name was cimetidine. So you would put cimetidine. Cimetidine is an H2 blocker. Its drug stem is tidine. What do we use it for? We use it for GERD, and we're going to find out that we can also use it for ulcers. And then, is there any special note for it? There may or may not be. You're not going to turn this in. This is a study aid. As you go forward into your disciplines, especially those of you nursing, pharmacology, in any mode later on, these are going to be really helpful because this is giving you snapshots. So again, here we've got esomeprazole. So we've got Nexium, PPI, Eprazole, Oprazole, GERD, heartburn, and again, if there's any kind of special note from the chapter. So as you're going through, you're just this is just a worksheet. Do it, don't do it, it's up to you. Now, when it comes time for midterm, I know I'm talking, it's not that far off, but midterm, you're going to have to match your drug stems, and you're going to have to know what class of drug is what body system. So something like this is going to be very beneficial for your studying later on as a quick reference. Okay, let's get back to, so moving back into the content from the chapter. first we have the drugs that are now used for peptic ulcer or gastric ulcers. So some of you may not know what that might look like. It's actually a sore either in your stomach, that would be a gastric ulcer, or a peptic ulcer would be a sore in your intestine. Now, we already talked about H2 blockers. I'm not going to go back over those. We've already talked about how they work. Same with proton pump inhibitors, but we're going to talk about prostaglandin drugs, surface protectant drugs, and drugs that we use to treat H. pylori. All right, so H2 blockers, TIDINE, proton pump inhibitors, Oprazole, Eprazole, prostaglandin drugs, prostaglandin agonists. So these act like a natural chemical that we have in our body. Prostaglandins are sometimes abbreviated PGs. Prostaglandin is important for the chemical that protects the stomach. So it helps to prevent the stomach from being broken down by that hydrochloric acid that we need to digest our food. Some medications will interfere with the body producing prostaglandins, especially the drugs that stop inflammation, like aspirin, steroids, and NSAIDs. Those are all prostaglandin inhibitors. Taking those medications can increase a risk of getting a stomach ulcer. To replace the prostaglandin that's being blocked by those other drugs, we're going to use the synthetic form of prostaglandin to restore that balance. So the drug identified as a prostaglandin agonist used to treat ulcers is known as misoprostol. Misoprostol, we have that drug stem. Oh, I didn't give you a drug stem notification in here, but I'm going to write that in or circle it because it's going to be here in this drug name. It's, whoops, started it too late, Prost. And that's going to help you identify that it's a prostaglandin. So we have misoprostol, and that tells you it's prostaglandin. Now, just to note that this is not a prefix or a suffix. This is actually an infix. It's in the middle of the drug name. They can fit other places. This drug, the brand name is Cytotac. Cyto means cell, and it's protecting the cells in the stomach lining. So that's how they came up with the brand name. Now, there are many different prostaglandins that the body can produce, and they have multiple actions. But prostaglandin that helps protect the stomach is the same prostaglandin that can cause uterine contractions. So this drug should not be given to women who are pregnant. There's a note. You want to put that in your notes. Don't take this if you're pregnant. But I do like the old drugs, when it was made by Searle, actually had a picture of the stomach on there. It told you what it's being used for. So misoprostol is Cytotac. It is a prostaglandin agonist or a prostaglandin drug, and it helps to treat ulcers or prevent ulcers, drug-induced ulcers. The next drug is a surface protectant drug. This is actually a liquid Band-Aid. I know it doesn't show up very well here on my label, but this drug is sucralfate, which is known by the brand name of Carafate. So those names kind of match. Now, it comes as a tablet. It fits a tablet. It has to be chewed, and you have to drink water, because what it does is it makes this kind of thick paste when the breakdown of that tablet mixes with the water, and it creates a liquid bandage to protect against an ulcer. This is what's in the liquid form. It's an oral suspension. It's what we call a slurry. Now, these are considered to be topical, so it doesn't really absorb into the body system, and it'll pass out through the feces. So it is kind of pink, so it can change the color of the fecal matter. But again, this is like putting a liquid Band-Aid, kind of like new skin. In a sense, if you have a cut on the outside and you're protecting it, this would be an internal liquid bandage. So this is sucralfate, which is known as Carafate. And we do have combination drugs. These help prevent the formation of ulcers in patients who are taking those NSAIDs or anti-inflammatory agents. Some combination agents can have a proton pump inhibitor with an acid, like we've already talked about with the Zagerid earlier. Now, one of the main causes of an ulcer is actually a bacteria, and that bacteria is known as H. pylori or Helicobacter pylori. So to treat ulcers caused by this bacteria, we're going to use antibiotics or anti-infective agents, and often an antacid. So this example is got the combination of the antibiotic of tetracycline, and then the antiprotozoal is metronidazole, and then your bismuth subsalicylate is your coating agent kind of thing. So Hylidac is one of the brand names, and it's a combination, and this is actually 3 separate doses that you take together. One of these is the antibiotic, one of these is the metronidazole, and then the pink is the bismuth subsalicylate or subcitrate, that's like Pepto-Bismol. And then Pylera is actually everything combined into one tablet. So these are 2 of the brand names that have the same ingredients. They're just kind of dosed a little bit different. Okay, so as we continue through the upper GI system in the stomach, we have the antiemetic drugs. So emesis is the medical term for vomiting. So these are drugs that work for nausea and vomiting. And we've got our little dinosaur over here that's vomiting. So antiemetics treat nausea and vomiting. We often will notate that as N/V. There's basically 3 different modes that can cause vomiting in the body. Something irritating your stomach. When we have infection, it can tell our brain to try to get it out. And then there's also an area of our brain that's called the chemo trigger zone, or the CTZ. That's known as the vomiting center in the brain, and that can be activated by medications like narcotics or chemotherapy drugs, or by elevated levels of neurotransmitters like serotonin or dopamine, or by pathogens. We can also feel sick if we've got something irritating our gastric mucosa. The drugs that we use for nausea and vomiting, there's a number of them, and many of them come in different dose forms, because if somebody's actively vomiting, maybe they can't take something orally. So maybe we need to give them a shot, or maybe a suppository would work, or an orally dissolving tablet, something they can put in their mouth and will dissolve quickly. They don't have to swallow it and get it into their stomach to get it in their body. We also have some in patch form, especially for motion sickness. So there's lots of different routes. Now, people who have intractable, what is kind of non-controllable vomiting, their biggest risk is going to be dehydration. The first class of drugs, pharmaceutical class, are anticholinergic drugs. I love these little, I got these from Picmonic. So they're cholinergics. So acetylcholine is a neurotransmitter. These are going to block that. It helps with nausea and vomiting. Anticholinergic drugs will block the movement of the peristalsis in the GI system. The route of administration for your anticholinergic drugs, they can be oral, or as we see here in this image with scopolamine, it could be topical or transdermal. They help prevent nausea and vomiting. Generally for this transderm scalp, it'll last for 3 days. So they put it on and they leave it in place for 3 days. If you've ever taken a cruise, you might have used one of these. I referenced that on a previous chapter. Now, anticholinergic drugs have a specific set of side effects. I've already discussed this previous chapter, but let's review. dry mouth, urinary retention, constipation, and blurred vision. That group are known as anticholinergic side effects. Next are antihistamines. So usually when we think antihistamines, we think, oh, allergies. But antihistamines can also be used to help with nausea and vomiting because they block that CTZ in the brain. Now, even Benadryl, diphenhydramine. But I picked meclizine, which is Bonine, and it says right here on the box for motion sickness. And then your book showed Dramamine, which is dimenhydrinate, as your antihistamines. Just so you know, antihistamines are also anticholinergic side effects. So just to kind of keep those. Now, the main side effect with some of your antihistamines is going to be drowsiness. They make you sleepy. Dramamine can make you sleepy. If it's the less drowsy, like this one over here in the blue package, Bonine, meclizine is going to be less drowsy than dimenhydrinate. Other drugs we can use for nausea and vomiting, we have cannabinoid drugs. Cannabinoid drugs are controlled substances. Sesamet, which is Nabinol. This is a C2, where Marinol, Dronabinol, Marinol, or Syndros are, well, Syndros is a C2. Marinol is a C3. These drugs act like THC, which is found naturally in your cannabis product, marijuana. They are used to treat chemo-induced nausea and vomiting, or CINV, when other things aren't as effective. Marinol can also be used to stimulate an appetite. So it can also be used to treat anorexia. Now, your book does have a little area, it's a little green banner, Focus on Healthcare, and it talks about using vitamin B6 to help with nausea, and that's really one that we use in treating prenatal or morning sickness. Again, it's a vitamin, so it's not going to have complications that another prescription drug may have. And then, whoops, I clicked too fast. Go back. The next class are the dopamine antagonist drug. And this is a prokinetic agent. I already talked about it a minute ago. This is metoclopramide. This is Reglan. As a dopamine antagonist, it's going to block dopamine receptors in the chemotrigger zone. And we also use it to treat post-op nausea and vomiting. And sometimes we use it in treating chemo-induced nausea and vomiting as well. Then we have neurokinin-1 receptor antagonists. These are blocking receptors, antagonists. You don't need neurokinin-1. You can remember NK1. So an NK1 antagonist or NK1 blocker will block neurokinin-1, which is a chemical substance that it's called substance P in the in the vomiting center in the brain. It's going to act on the nerves in the intestine, and we use this mostly post-operatively for nausea and vomiting or chemo-induced nausea and vomiting. Now, the neurokinin-1 receptors do have a drug stem, and the drug stem for these are Prepint. I know this slide is not very clear here. This is fosaprepitant. If the ends in prepitant, that's kind of your known drug stem for your neurokinin-1 or your NK1 antagonist. And then the next group, so there's lots of different drugs that we can use to treat nausea and vomiting, right? Well, what's causing it? Maybe one person responds. Maybe we don't like the side effects from one drug. We've got another one to pick from. So there's lots of choices. Also, deeper level of pharmacology, we'll talk about what other medications is the patient taking and what could the interactions be. So that can also kind of determine which drug would be selected. But again, we're just learning the classes right now. So the next class is a phenothiazine. Phenothiazine, promethazine. We're looking for the thiazine kind of thing. Phenergan. Some of you maybe heard Phenergan. We use it for coughs too. Yes. It is a phenothiazine. It's also an antihistamine or an anticholinergic. So sometimes we get crossovers for these drugs. So that can be a little bit confusing. But we're going to keep this in the phenothiazine group. The antiemetic effect of these drugs is a result of their anticholinergic effects, although these originally were antipsychotic agents. Pyrazine, methazine, thiazine in general kind of is your drug stem that we're going to kind of be looking for. Let me pick a lighter color as your drug stem. And again, it comes in different dose forms. So Phenergan, generally when we think of it orally, we're using it for cough medicine, but here this is an injectable. It can be given in IM or IV, and then it's also available as a suppository. So if somebody is vomiting and they can't swallow anything, we can give it through another route. The next group are your serotonin drugs. These are actually serotonin antagonists. So I'm going to fix that right now as I'm on this slide. And make sure we got that on here. Serotonin 5-HT receptor blocker drugs. So these are antagonists. So their mechanism is they are blocking this 5-HT, which is a serotonin receptor. So that's why I have it in parentheses. We generally will often call these 5-HTs, and then the specific receptor will be noted in the subscript. If you see 5-HT, 5-HT is the same thing as serotonin. So serotonin is also known as 5-hydroxytryptamine, which is why it's 5-HT. Now, these were first developed for chemo-induced nausea and vomiting, but we also use them for post-op nausea and vomiting or intractable nausea and vomiting associated with migraine headaches, or if somebody even has the flu. Now, what do they have in common? Their drug stem is cetron. So, ondansetron, and the brand name for that is Zofran. And we see that it's available as an injection. It comes in tablet form. It comes in multiple of forms. It comes as an orally dissolving tablet, so that it will help with nausea and vomiting. So if you ever see the drug granasetron, you're like, oh, I don't know what that drug is. But you know it ends in cetron. You know what it's used for, because you can make that association. And other antiemetic drugs. So when we're talking, there's some that kind of fit in maybe more than one place or don't really have their own home. So we're going to call these other, or your textbook put perfenazine and prochlorperazine in the others, but they actually are phenothiazines. I'm kind of a little not in agreement 100% with the way the author does that, but it depends on where your reference materials are from. So it does talk about, your book talks about the drug trimethylbenzamide. Trimethylbenzamide is known by the brand name of Tigan. Tigan also comes as suppositories. It comes orally and it comes injectable. These are going to inhibit or block that chemo trigger zone. Then we also have the combination drug here of fosnetupintent. So we got that pitant, and also paloncetron. So it's a combination of the NK1 inhibitor and a 5-HT3 inhibitor. And this is a Kinezio. There we go. It took me a minute, but I got it.